This is the Nuance podcast by Medicine Explained. We're your hosts, Amanda
and Dan.
We talk to experts on health, the human experience, and the intersection of climate and human health.
We explore the nuance that's been lost in today's conversation. These are ideas that aren't touched upon in headline culture and most media outlets.
We don't take ads because we want to keep our information unbiased, but we do need your support.
So leave us a quick review on Apple Podcasts or Spotify.
In today's conversation, we have the honor to speak to Dr. Susan Clayton, who is a Whitmore-Williams Professor of Psychology and Chair of Environmental Studies at the College of Wooster. Her PhD in social psychology is from Yale University. Dr. Clayton was lead author in a major scientific report by the Intergovernmental Panel on Climate Change, a body of experts convened by the United Nations. Dr. Clayton was a lead author on the chapter titled Health, Wellbeing, and Changing Structure of Communities. This report was released on the 28th of February, 2022. Dr. Clayton has authored multiple books and reports and explores the connections between people and nature. So we mentioned the IPCC report a lot in this conversation. IPCC is an abbreviation for the Intergovernmental Panel on Climate Change. Dr. Clayton will go on to explain more about what this report entails. In this conversation, Dr. Clayton explains what environmental psychology is. She explains climate anxiety and other mental health issues that are associated with the environment and climate. Primarily, this conversation was to address what the IPCC report detailed, with a specific focus on mental health. We also talk about how we should be reporting on climate in the news. Dr. Clayton gives actionable tips on how to address climate anxiety and what structural changes are needed to prevent and treat mental health issues surrounding climate change. I really enjoyed and appreciated this conversation with Dr. Clayton. I hope you do too. Now, on to the podcast. Hi, Dr. Clayton. Welcome to the podcast. I'm so looking forward to chatting with you. We share an alma mater, Carleton College, which is really exciting. And you've done some amazing work, so it's really a privilege to speak with you today.
Well, thanks for the invitation. I'm really happy to be here with you.
Absolutely. So I would love to just get started a little bit on your story and in general, how did you get involved with environmental population and conservation psychology? And can you also define that for our listeners?
Sure. Well, what order should I address those questions in? The topic of environmental psychology has been around for a while, since about the 50s, when people were looking at things like impacts of physical spaces, lighting and color, people. And then during the 60s, a lot of research started into how do you encourage recycling and things like that. But it was a fairly small subfield of psychology, and I certainly didn't learn anything about it while I was in college or graduate school. So I'm trained as a social psychologist, but I'm very interested in environmental issues. And shortly after I got my doctorate, I was just talking to friends who are also psychologists and thinking about the way people thought about environmental issues. And I realized that there was a psychological component to this as well. So I really turned gradually my attention to, again, environmental issues. How do people think about them? How are people affected by them? How do they talk to each other about them? How do people construct their relationship with the natural world? And so environmental psychology, very broadly, is just the study of how people are affected by and have an effect on their physical environment, which can include the built environment. Conservation psychology is a kind of a not completely overlapping area that is explicitly trying to encourage people to behave in ways that protect the natural environment and hopefully support a positive relationship between people and the natural environment.
Thank you so much for outlining that for us. And I came across your work because you were the lead author in the recent IPCC report, specifically on the chapter that talks about health and the climate. And this is the first time that they've talked about mental health in an IPCC report. Can you explain to us how you got involved and who reached out to you and kind of the process of this IPCC report?
Sure. Well, let me give you a little background on the IPCC for those of your listeners who don't know what it is. And since I have colleagues who don't know what it is, I know there are a lot of people like that. It's essentially a body put together by the United Nations. It's an international group of hundreds of scientists who volunteer their time to look into the published research on climate change, what it looks like, what's the evidence for it, what are the effects of climate change, including effects on human beings, and then what are some things that can be done to mitigate it. So it's really, the IPCC is really considered the kind of definitive body. They don't advocate for particular policies. They just say, here's what we know. So the review process is very tedious, I'll say, very comprehensive. There's reviews by other experts. There's reviews by governmental bodies. So what's finally reported has really been agreed upon by a lot of people. And they actually shared the Nobel Prize as a committee back in 2007 for the work they were doing to report on climate change. But they produce reports every 5, 6, 7 years, sort of depending on the circumstances. So as you say, they really had not been paying attention to mental health, but somebody realized that they should pay attention. And it's kind of hard to pinpoint exactly, who the actors were. But I had been working with the American Psychological Association for years to try and get them to be more mindful of the kind of psychological side of climate change. So I was just ready when they were given the opportunity to make recommendations to the IPCC for people who could contribute to the upcoming report. So again, who knows exactly what went on behind the scenes, but it was because of my existing work and particularly my involvement with the APA that I think that I was recommended for that position.
Well, thank you so much for the work that you do. That's so important. I mean, I'm currently in medical school. I graduate in a couple of months, actually, and which is exciting. But something that we don't talk about that much in healthcare is the impact of the environment on health. And so I've become more and more engrossed in that specific field. I've become part of local activist groups. And even though it's not talked about in medicine, it's pretty obvious how health is impacted by climate, and more people are reporting on it. But this is really the first time that mental health is really being brought up. But you can clearly see that people are really suffering from mental health issues related to climate. Do you mind outlining what some of your findings were in the IPCC and in the Health, Wellbeing, and Changing Structures of Communities chapter, specifically with your expertise?
Sure, absolutely. So you're right that not a lot of people have been thinking about mental health impacts, although if you stop to think about it, it's kind of quite logical that there are such impacts. And I'll outline maybe 3 or 4 main ways in which that happens. The most clear-cut one is extreme weather events. We know that climate change has already led to more serious storms, more intense storms, flooding, wildfires, things like that. And not surprisingly, when you go through that kind of experience, it can be a very traumatizing event. And you definitely see elevated rates of post-traumatic stress disorder, anxiety, depression, substance abuse, even increased thoughts about suicide. So that research has been done for decades before, it doesn't have to be linked to climate change to know that there are mental health impacts of extreme weather. But definitely that's predicted to rise as the effects of climate change become more obvious. A second channel, and we have really good evidence for this, but I think a lot of people are not aware of it, is higher temperatures. Higher temperatures have an impact on physical health. We know people die in heat waves, but they also have an effect on mental health. And we have expanding body of research that shows that admissions to psychiatric hospitals tend to go up during heat waves, and suicide goes up during heat waves. We already know that people are more aggressive when the temperatures are higher, and there are potentially long-term impacts from exposure to elevated temperatures for a long period, especially among children. So that's really something to be mindful of, especially for those people around the world who don't have access to air conditioning. And another I'll just say briefly, there are indirect impacts of climate change on mental health. So one of the impacts of climate change that people are most worried about, or scientists are most worried about, is the impact on food insecurity, that agricultural productivity is going to be affected, the nutritional values of some foods are affected, and that food insecurity actually, in addition to, of course, having physical health effects, also has mental health impacts, and again, potentially long-term impacts. And then the last thing that has really only started to get attention to the last few years, but has gotten quite a lot of attention, is the idea that just worry about climate change has the potential to affect our mental health. And so, what we've called climate anxiety, that dread or fear or worry about this uncertain but troubling future that lies ahead.
So specifically for climate anxiety, can you explain that a little bit more? And I think that for me, I definitely feel anxious about the climate, but it's a motivating factor. So when does it become a motivating factor? And if people do have this climate anxiety, what are some of the recommendations that you have to maybe make it a motivation or just even reduce the anxiety? They don't have to do anything towards the climate.
Absolutely. You've raised such important questions there. Climate anxiety it's not a formal diagnosis. There's not an explicit agreed upon definition. It's not a mental disorder. So I would describe it as a pattern of negative emotions associated with your awareness of climate change. And anxiety is kind of the main one, but it can be a very complicated pattern of emotions, including, anger, frustration, sadness, fear, etc. And the big question is, well, is this a threat to mental health or not? And there's been a lot of research actually around the world, again, just in the last year or two, that has found that climate anxiety is associated with general measures, established measures of anxiety and depression. So there is a link, but it's not a perfect connection. So I think the big question is, what allows anxiety to be a motivating factor for people, and when does it become a threat to mental health? It's certainly not, it's totally rational to be anxious about climate change, but it takes, I think, certain kind of emotional skills or abilities to respond to that anxiety in a positive rather than a negative way. And I can keep going to talk about, what people should do if they're feeling anxious, if that makes sense.
Yeah. So if someone has experienced climate anxiety, what general recommendations do you have for folks who are experiencing that?
Absolutely. And I think one important thing is people tell me they feel validated to hear it being talked about. It's comforting to hear that this is named, that other people are experiencing it too. So one of the most important things can be to connect with a group of other people who are feeling something similar, just so you know you're not alone and you don't feel like your view of reality is called into question. So connecting with other people is very good for your mental health. Getting a little bit more information, or a lot more information for that matter, can be helpful. I think a lot of times when people are anxious, it's because they hear a lot of vague information, but they don't know exactly. So people say things like, oh, the entire planet's going to burn up in 20 years. And, that's extremely unlikely. So getting a little bit more specific, accurate information can help people to feel a little bit more in control of the situation, just because they understand it better. And for a lot of people, I would definitely recommend that they find a way to get involved, in a way that's comfortable for them. So that could include political activism. It could include forming a community group, or it could just include, making decisions about how they'll run their own life and their own household to address climate change. But taking action, again, it helps you to feel like you're not a passive victim of circumstances, but you're actively engaged, and is empowering, which tends to be inconsistent with the idea of high levels of anxiety. Now, all that said, I think it's also important for people not to feel like they're personally responsible for solving the crisis, so that every single thing they do has to be correct. And there are people whose anxiety is so powerful that the first thing they need to do is just get in control of that anxiety. So things like mindfulness techniques, deep breathing, taking a break from social media, so that you're not constantly doom scrolling, going for walks, especially in natural settings. So all of those ways to just lower the stress and get on top of your emotions, and seeking mental health care if you're feeling, really, really anxious. But for people whose anxiety is at a more moderate level, those other techniques of getting informed and getting engaged are really helpful.
We know that like the algorithms in Facebook, TikTok, Instagram, etc., if you have a fear-invoking post or something that triggers anger, you actually look at that post longer. So it keeps you scrolling more and more. So the algorithm feeds into showing you more and more fear-inducing content. So for the media, how do you think that we should be reporting on climate change specifically to give people information, but also maybe more hope, or people aren't as fearful and it doesn't induce this anxiety, but more call towards action?
Absolutely. Hope is so important, just to keep yourself motivated as well as not overwhelmed. It's funny, I when I talk to media, to reporters, they often say things like, well, do you think we should be doing things differently? And I usually say, well, yes, but I haven't seen a huge change yet, because you're right that the more anxiety producing stories tend to get more hits. But I think, and there is some evidence that people experience greater anxiety after being exposed to that kind of media. The answer is not for the media to stop reporting climate change, because I do think, it's a real problem and we need to be aware of it. But I think there is more positive news out there than people are sometimes aware of. And I think the media could do more to draw attention to positive developments and possibilities, both technological and behavioral and governmental, so that people have a more balanced view of the situation.
For the IPCC report in general, I know that you were a lead author on one of the chapters, but what are some of the general takeaways for the general public about the IPCC report in whole?
The first, so in theory, we would have had 4 in-person meetings. In fact, we had 3, and then the last one had to be online. But the first one I went to, again, I'm in a room with hundreds of scientists, and they're really from all over the world. And I've certainly been involved in international collaborations before, but nothing like this. So I'm hearing from people who are from the Philippines, and who are from South Africa, and who are from Brazil, and really places that are experiencing very strong effects of climate change already. And these are extremely knowledgeable people who have a lot of information about what climate change is doing. And so, as you say, the information is actually, it's pretty serious. I'll put it that way. But these people were not walking into the room, with these somber expressions on their face. They were smiling, they were happy. These are people who are, again, devoting hours and hours of their lives to doing this job. And they wouldn't be doing it if they thought it was worthless, if they didn't think it was worthwhile. So there was a lot of optimism for me just in being involved in that collaborative effort. And I would say the main messages of this particular report are that we know even better than we knew for the last report. Just the evidence is stronger and stronger for the effects of climate change, not just the future effects, but the effects it's already having. We also talked, obviously, a lot more about mental health, as we've been talking about today. There's a lot more emphasis on the inequities, how different groups of people around the world are differentially exposed to the impacts of climate change, but also some thoughts about what could be done to start to address these issues and to keep society more resilient in the face of climate change.
I'm very glad that the IPCC report specifically address both mental health and then also the inequities, because like I was saying, I'm working with groups in New Orleans, and the populations that are most affected who are feeling the impacts of climate change, even though I feel like we all are, but we don't necessarily like relate it to our houses are flooding because we're not as vulnerable as some of the other populations. But some of these communities, I mean, they're being either poisoned directly by like petrochemical plants along the Mississippi River, or like I said, with Hurricane Ida, their houses and their roofs were ripped off. So we have to have like community structure in order to like mutual aid in order to help rebuild these communities. But they're already feeling it. But like you were saying, all of these groups that I'm working with, you go into the meetings and everyone is hopeful. They're just such strong people. And even though they are already immediately feeling these impacts, they're working so hard against some of these structures in order to make their lives better and then our like the future lives better as well. So that is really motivating.
Yeah, it's a good illustration of how getting involved can be good for your mental health.
It's so easy to get involved in groups and everyone's so welcoming. And so for any of our listeners out there who's like, how do I even get started? Just finding any local community activist group. And a lot of the meetings are online right now. So just like zooming in and seeing if you feel like you fit in and they're welcoming. And so far it's been very welcoming. And if you just put your foot in, like it's full force. The other thing that I would like to address is that we are experiencing some of these mental health issues that you're talking about. And you said that heat specifically, which I kind of want to go into, can affect suicide rates, aggression. Do we know what the science is behind why heat waves cause these?
Not completely. Mm-hmm. There are several possible mechanisms, and my guess is that there is more than one reason. So lots of research showing that heat, for example, is frustrating, and frustration can kind of make you more likely to be aggressive to other people or even to yourself. Your attention span starts to get narrower, so you're less likely to think of alternative behaviors, and you might just seize on the one that comes to you first. There can be obviously physiological effects of heat, including on the nervous system. I mean, heat is one of the things where there is an upper limit to what we can cope with, and you can't just get used to it. There's literally, a heat level above which the human body shuts down. One of the mechanisms that we know is partly, or we have good evidence to think is responsible, and it's so straightforward, is heat makes it more difficult to sleep. And anybody who's ever had a lack of sleep, like probably medical students, for example, or new parents, it sounds trivial, but it's not trivial when you get into a lot of days of very poor sleep. You're just stressed, you can't think straight, you can't concentrate. And yes, you're irritable. So that's part of it as well.
So if some of us are experiencing things like climate anxiety, and you touched a little bit upon this with the heat examples, but even if we're not actively thinking about climate change, and that can specifically affect our mental health because we get anxious about weather events or our future, how can climate affect our mental health, even if we're not consciously aware of it?
Well, so the social climate can affect your mental health. And so that can be, if that's affected by climate change, that could have an impact even if you're not thinking about climate change. So a lot of the impacts are there whether or not you're thinking about climate change. And I mentioned a little bit about food insecurity also. Involuntary displacement associated with climate change. If you have to leave your home community because of flooding or major storms or wildfires or sea level rise or any of those other things associated with climate change, that tends to be associated with increased rates of mental illness because it's disruptive, it's stressful, it takes away some of your sources of resilience.
Yeah, absolutely. And do you know some of the figures of people who are impacted by climate change who have to involuntarily move?
Not on the top of my head. I feel like it might have been something like 20 million people in the last year were displaced by weather-related events, but
whatever it is, it's a huge number. And even if it doesn't directly, specifically, I've never had to move because of a weather event. I did have to evacuate from Ida, but luckily I'm privileged enough to have left and come back when the city was working again. But I think something I've started to think about more and more too is that even if I'm not directly being displaced, there's 20 million or so people who are being displaced moving into other areas. So it is affecting everyone, even if you're not the one moving. Have we had any research on how that's affecting populations?
You're exactly right that even if you're not a refugee, you can be affected by this. And actually, the U.S. Defense Department considers this a risk, a national security risk, because of the awareness that people are likely to be displaced by climate, and that can lead or increase the rate of international conflicts as well as conflicts within nations, because people are competing for available land, for example. And we've seen that refugees may be welcomed at first. And for example, I think right now the situation is pretty good in terms of welcome for Ukrainian refugees, although it's still extremely stressful to be a refugee. But we've also seen lots of other examples where refugees are not welcomed with open arms, and there is, conflict within the receiving community. So yes, those who weren't displaced are also have the potential to be affected. Mm-hmm. And I think it's important for people to realize that although we tend to think of refugees as coming from abroad, people from the Middle East or, from low-lying islands, there are already climate refugees in the United States from the Gulf of Mexico and in Alaska, and there are going to be a lot more as the sea level rise makes more coastal residences impossible to inhabit.
Yeah, it's hard because also these are people's homes, and some people, I think it was Hurricane Ida, Hurricane Katrina, some of the refugees or the displaced folks went to different places in Texas or in Alabama. And there was a little bit of hostility towards them. Why would you live in New Orleans if you know that it's going to flood? And they're like, well, this is where my family's been. This is where I've lived. This is my home.
Yeah, I think you're exactly right. Many people have, of course, powerful emotional connections to their home, but there are places and groups of people for whom that connection is particularly strong, but it's not just about where they grew up, but it's a whole cultural tie to that area. And I think that's particularly true for a lot of people in New Orleans or in the general Gulf of Mexico, and especially true for indigenous peoples as well, that their connections to the local landscape are an important part of their culture. So leaving is not just a matter of, let's find a cheaper place or a place that, will withstand the storms better. It's leaving the place that matters so much to you, where the culture is such an important part of you.
Yeah, absolutely. And so you said that you've worked with international groups before, but this was a big international collaboration. How do you see people from other countries reacting to climate change that differs from the U.S., either in a positive or a negative way, in the way that the U.S. is addressing climate change?
Well, the thing that I'm most conscious of is, in the U.S., climate change is so polarized, politically polarized, and I think that's decreasing a little bit, but it's still very powerful. That it's seen as an issue for the political left more than for the political right, and that's less true. It's not. It's somewhat true in other places, but it's less true in most other places. And in some places, it's not true at all. They're just climate change, it's a thing. They might disagree about how to respond to it, but it's not a political football. So I think that's been a real problem for the United States that has definitely set up additional barriers in terms of our ability to respond. Now, a lot of places are not necessarily, I don't want to kind of call out and criticize any particular countries, but it's certainly not the case that other countries are doing everything right and the US is doing everything wrong. I think politicians all over the world have a hard time thinking about the long term as opposed to the short term.
Mm-hmm.
So addressing climate change might require some sacrifices in the short term that are more than compensated for by the long term, but there's no incentive for politicians to think about the long term.
Mm-hmm.
But, so in different places, people are aware of it and responding to it in different ways. I will say in some places there are very good, there are governmental organizations or government affiliated organizations that are set up to start to think about climate change and to start to encourage more sustainable behavior in a way that I think is more forward looking.
Yeah. And that's why this IPCC report and you working on this is so important, because y'all came with an international agreement about what the science shows. And then you also said that some of the IPCC report is addressing some solutions. So can you broadly talk about what the IPCC report said that some solutions could be? And then I would love to move on to what you think some of the mental health specific solutions could be for preventative measures and for increased healthcare access.
Yeah, it's hard to be too specific because what needs to be done will be specifically different in different contexts. So the general principles are, first, be aware of climate change and take that into account. I think that's the best way to be resilient. So that might mean, especially in things like city planning, anticipating stormwater surges and perhaps serious storms. So there can be building codes that address those. Hurricane, was it Harvey that affected Houston really badly?
Yeah.
And there was a lot of flooding. A lot of that flooding could have been reduced if there was more permeable, surface on the ground. So try not to have so much asphalt. Try and include places for rainwater to sink in, building and designing cities with those kinds of things in mind. Of course, there might be building codes about, not constructing buildings too close to coasts or on floodplains, for example. So there's all that physical infrastructure, and then that sort of more social infrastructure. I think planning needs to be inclusive and to be mindful of the ways in which different people will be affected and allow everybody to kind of speak about their concerns and their needs. Because sometimes plans, right now, even in the US, a lot of plans for dealing with severe weather do not take into account people who are physically disabled. And so there were warnings that are broadcast on the radio that are not available to people who are hearing impaired, or, buses that were designed to evacuate people, but that couldn't take wheelchairs, things like that. So being mindful of the needs of a wide variety of people. And then a healthcare system that is prepared to deal with the kind of impacts that will follow, both the extreme events and then the high temperatures, for example. So I remember, I think this was before the pandemic, so that probably makes it 3 years ago, but there was a really high temperatures in Phoenix and the planes couldn't take off. And people, as I said before, people can't cope with temperatures like that. So cities need to have cooling centers and more tree coverage to help keep the temperatures down, and planes that can take off, if you're going to be flying, planes that can take off even when the temperatures get that high, and so on. So just planning ahead and taking it into account in all those, both physical and kind of social and institutional structures.
Yeah. And isn't it 15 degrees Fahrenheit or so hotter on asphalt as well? Asphalt just makes that so much hotter. And not only does it increase the heat of cities, and like you were saying, Harvey was so destructive in the fact that it also couldn't absorb water into the ground because we've put cement on everything. It also affects the water cycle. I read Judith Schwartz, Where the Water Goes or something like that, but her book on the water cycle, and how in California, especially because there's miles and miles of asphalt on the coast, that it's created even worse desertification of the interior of California. So it's all interconnected. And I really appreciate that people's abilities are taken into account in creating structures that can become more resilient. And then specifically for mental health, what do you think some of the best preventative measures can be for that, and healthcare resources?
Yeah, when it comes to mental health, I think it's kind of underfunded, probably in every country in the world. There's still some stigma attached to mental health problems. I do think that the COVID pandemic has reduced that, as we realize that everybody's kind of struggling with their mental health during the pandemic. So I think in the past, there was a lot of sense that, well, people just need to pull themselves together, and less recognition of the need for support services. So just expanding the availability of mental health care is really important. There are people, following a disaster, you have the first responders. There can be a sort of initial mental health response as well as initial evacuation and so on. So that can be helpful. In a more general sense, I think it would be good for society to move away from just having this, we only respond to mental health care when it's the need is already pretty high. But when it comes to physical health, we have at least the ideal that we have preventive healthcare, and we should have preventive healthcare when it comes to mental health as well. So checking in on people, as they to see, are they beginning to get anxious about climate change? Can they be trained in some self-care measures that will help them cope with these levels of anxiety, or maybe with their post-traumatic stress disorder from the hurricane or the wildfire that they lived through? Right now, we don't have enough mental health professionals to meet the demand, but a lot of these things could be, just as a lot of physical health care was sort of moved from physicians to well-trained nurses, a lot of the things that didn't need an MD necessarily to respond to. I think a lot of mental health care could be handled by people who aren't necessarily, don't have a doctorate in clinical psychology or something like that. So allowing more of that early mental health care to head off the more serious problems that might happen later.
I really appreciate that you brought up preventative measures and the fact that we need to decentralize a little bit our healthcare response, because it doesn't have to be only an MD or like a psychiatrist or a psychologist, because I know that the wait list for patients is absurd, and that's treating mental health that's already been diagnosed, instead of what you were saying, there's not those like check-in visits to prevent mental health issues in the future. My partner Daniel is actually going into psychiatry. Like you were saying, we just need more mental health care professionals, whether that be like trained nurses, or even like I see it too with just a physical health, like having health coaches that prevent you from getting diseases. But a lot of our healthcare structure, even if physical health has like some preventative medicine, is way more focused on like treating acutely after the issue. So prevention is so important. And what are some techniques that you use or you would recommend our listeners to use to become a little bit more like mentally resilient or prevent some of these measures? I know you touched a little bit on it in the beginning, but yeah, what are some of the things that you recommend?
Yeah, and these are things, school systems too could start teaching these. And I think this occasionally does happen. Younger children can be taught these sort of self-care strategies to check in with yourself, to recognize when you're kind of getting out of control. And I get very irritable when I'm tired, but at least now I know, or I actually get irritable when I'm hungry too. So now if I'm feeling irritable, I can stop and say, am I tired? Am I hungry? Maybe I should go get myself something to eat or whatever, and sort of have a little bit more understanding of my response that way. So check in with yourself and how you're feeling. It sounds silly, but it really works to engage in gratitude. Think about what you're grateful for. Think about the sources of support you have. So when you're feeling overwhelmed, just to think about a few positive things can be a really good strategy for kind of adjusting your emotional balance. Mental health is something that you can kind of train for, as you can train for physical health. So you can practice becoming better at regulating your emotions and exercising self-control so you don't just lose it when you're under a lot of stress. again, the mindful breathing, a lot of, as you know, physical and mental health are closely intertwined. So keeping kind of active and good physical health, eating healthily, getting lots of sleep, those will definitely have positive impacts on your mental health as well. Keeping connected to others. And sometimes when you're feeling overwhelmed, to take the focus off yourself and just think, okay, it's not about how I'm feeling. Let me go see if I can do something for someone else, because helping someone else can make you feel a lot better yourself, actually.
Those are really great recommendations. And I know that you also mentioned earlier on, go take a walk in nature. And that's something that I love as a recommendation, because for me, being out in nature for only like 5 minutes makes me feel so much better. And not only are you getting exercise if you're moving out in nature, but like that connection that you feel too can also help like motivate. If you're too overwhelmed, then you don't have to go do anything, but it helps me and motivates me to like conservation work. And it helps to be like, this is what I'm trying to protect, is this like beautiful nature and human health and planetary health. And
that's exactly right. And there's a ton of research on, it's not just wishful thinking. There's very good quality research showing that spending time in nature is good for your physical health, your mental health, your stress levels, your creativity. And probably a lot of people have heard about forest bathing in Japan. But even I believe in Canada, they have a newish program where doctors can literally write you a prescription for nature, and it gets you free or reduced access to, national parks. I'm not getting the details right, but so more and more people recognizing that connection. And just the rhythm of walking can be very good in calming down your mind as well.
Yeah, absolutely. Do we know what the mechanism is behind why nature makes us feel so good?
Again, there are probably a number of mechanisms. Some people have speculated like the air quality might literally be better. So you're getting better quality air to your brain.
You can think better.
Greenery tends to filter out some pollutants, for example. Or there might be, some people have speculated about, good chemicals that are being released by plants. It's certainly something about the visual perception, which getting at that idea of fractals, that nature, unlike I'm looking out the window at an apartment building right now, built settings tend to include mostly straight lines, and, they're very rigid, and nature has much more complicated visual elements that might be good. They attract our attention, but they don't stress us out. Nature is very multisensory, so you're not just focused on your visual field, but you're also getting auditory information, olfactory information, the tactile feeling of breezes or rain. So it's really stimulating different parts of your brain in some ways.
Wow. And so we're starting to wrap up our conversation, and I have 2 short questions for you. But before I ask those last questions, is there anything else that you would like our listeners to know about the IPCC report or about your chapter on health and well-being?
I guess I would just emphasize that one reason I think the chapter is so important is that people have less awareness of the health impacts of climate change. And for a lot of people, for a long time, it was seen as, well, this is something that's going to affect, polar bears. The glaciers are going to melt. And that sounds sad, and it makes people sad, but it's not quite as important as when people see no human beings are going to be affected. They're going to have to move. They're going to lose their jobs. They're going to, in some cases, lose their lives. So recognizing the health impacts that are already happening is important, I think, for calling attention to why climate change is important to us. But the other important message is it is never too late for us to do anything about it. We should act quickly rather than slowly, because the more quickly we act, the more we can do to head off the worst effects. But even if we were to do nothing for the next 40 years, it would still be worth taking action at that point. So I think for some people, there's almost like a it's almost an excuse. Well, there's nothing I can do anyway, so I might as well give up. It makes life easier. We should not give up.
Mm-hmm. Thank you so much for that. Well, one of my last questions was what keeps you hopeful, but I feel like you kind of touched on that. But what does keep you hopeful?
Well, so I'm a psychologist, and I have a fundamental sense that most people, I'm not going to say most people are good, but all people are complex, and they all have good motivations and good feelings. And almost everybody really likes nature. Almost everybody would like to keep a healthy natural environment. So we don't have to, I think, create that motivation. We just have to help people tap into that motivation and kind of bring it out from behind perhaps some other goals or motivations that might be hiding in some cases.
I love that. All humans are complex. And then lastly, we ask all of our guests to finish the following sentence. The future is blank.
I would say the future is in our hands.
Beautiful and inspiring. Thank you so much, Dr. Clayton, for coming onto the podcast and speaking with us. But more importantly, thank you so much for the work that you did with the IPCC and just, your career in general. You're really contributing so much to the health and well-being of not only the population of the world, but just the entire planet. And I know that you said that it was hours and hours of volunteer work for this IPCC. So thank you so much for being willing to do that.
Well, it's a pleasure and it's an honor. And thank you. I can't believe you have time to do this in the middle of medical school. So thank you for calling attention to these topics.
Thanks for listening to this week's episode of the Future is Healthy podcast. If you loved what you heard, subscribe on wherever you get your podcasts. And if you think someone you know can benefit from any of the info we talked about, share this with friends and family and leave us a review on Apple Podcasts or wherever you listen to your podcast. We don't rely on paid ads so that you can trust we have no conflict of interest in any of the information we provide or talk about in this podcast. If you support what we're doing, you can help us to continue putting out content by clicking the link to support the Future is Healthy podcast. This podcast is for general education purposes only. It is not a substitute for treatment, diagnoses, or professional medical advice. It does not constitute the practice of medicine or other qualified professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information from this podcast and any of the materials linked to this podcast is at the user's own risk. If you are seeking advice for any medical condition, it is important to seek the assistance from a qualified, trained, and licensed medical practitioner.